At the beginning of this year, correspondent Ross Cullen went into the Gournay's hospital just outside of Paris as the pressure of the third wave of coronavirus cases was starting to recede. Now, 5 months on, he returns to the hospital to see how the nursing staff on the special COVID-19 ward have fared.
As France's third wave of COVID-19 cases recedes, patients who were admitted for coronavirus treatment continue to recover. But one longer-lasting effect is the mental impact on nursing staff, having to deal with 1.5 years of this pandemic in France and 3 separate surges of infections.
I'm a relatively new nurse and I was still in training when the pandemic began. It was pretty tough here, just as it was in every hospital. Psychologically, there was a lot going on. We had to look after patients, their families, and it was mentally tough to deal with the deaths as well.
To try to ease the pressure on hospitals, France closed the culture and hospitality sectors in October last year and then went into a lockdown light in March this year. For this hospital, the third wave of COVID-19 infections in the spring was more intense than the second surge in cases in the winter, but it did not last as long. More than 110,000 people have lost their lives to the disease in France, and the pandemic stretched hospitals to the limit, but some medical facilities were overwhelmed.
We had new patients with serious problems. Like the first wave, we had patients in wards like this having to move to intensive care frequently, where there was a regular lack of beds. We had totally different age groups coming in, like the very young and also the elderly, who, for some reason, had not been vaccinated yet.
This time last year, after the first wave, France's summer holidays went ahead as normal, but the mass movement and mixing of people sparked a long second wave. This time around, the hope is that the millions of vaccine doses already administered will help to control any possible surge later this year.